again. All right, go ahead.
Well, the Liberal Party really does believe that the whole health human resources issue is something that needs to have leadership from the federal level. We don't think poaching doctors and nurses province to province is actually a solution, and that we actually do have to get on with how we train more people, but also how we make sure to distribute it in the way that we need. We need more generalists, and therefore we need to be able to incent people choosing family medicine, and that is a multifactorial approach that I think the College of Family Physicians is doing a good job at, but we need to support them in whatever we can, whether it's family practice interest groups, whether it's the making sure that more family doctors teach in medical school so that there are actual role models. The other part is to make sure that we are recruiting students from the regions of Canada where they are really underserved. 80% of Canadians live in cities. 90% of our health personnel work in cities, so that there's a real maldistribution. And so we put into the platform a fact that if people will choose to work in rural areas, that there would be a $40,000 relief for their student loan, and $20,000 for nurses and nurse practitioners. If you go back to really the 2004 Accord, a lot of the things around health human resources were there. It's just that the federal government actually dropped the ball, and so people like Josh Tepper here in Ontario really had to drive a lot of the initiatives, and obviously dealing with foreign trained medical grads, dealing with Canadian students that have gone overseas, recruiting more Aboriginal community, primary care reform, e-health in all of its ways, and measures to reduce the financial burden on students in health education programs and participate in health human resources planning with interested jurisdictions was all in the 2004 Accord. It's really important that as we renegotiate that we make sure that we are looking after, we are a true partner, again, in the groups that I identified as being direct.
Dr. Bennett. I'm sorry to cut you off, but that's your 2 minutes. All right, we're going to go on to Georgina Wilcox.
So physician shortage really started in 1991 with Barrow's Stoddard report, which suggested a 10% cut in medical school places and the discouragement of the recognition of foreign medical grads. And I don't know what happened, but I got in as a foreign medical grad at that time. And this combined with net emigration and aging and physician choices led to a huge crisis of people not having access to a family doctor. And I know this in my day-to-day life. I have patients who are orphaned. I see patients in Emerge. I come across patients in different situations. They don't have family doctors. And I have to plead and beg to find family doctors for my patients. We currently have 195 physicians per every 100,000 Canadians, and only 9% of Canadian doctors work in rural Canada. But physician-to-population ratios are important. Studies have shown that jurisdictions that have high numbers of doctors do tend to have population health outcomes which are better across a number of health indicators, although admittedly places that have more doctors usually are better places to live, more wealthy, etc. Greens believe that the problem of physician shortage must be dealt with in a number of ways. We need to continue to train good Canadian physicians, and I don't think the government should impose still the restrictions on physician training that we have. It needs to be more open. Secondly, we support the expansion of primary healthcare teams, and I've talked about that, we've all talked about that. We all think it's very positive. Using these teams will provide better care and will help to prevent hospitalizations. And again, a safety culture, initiating a safety culture will lead to way improved care at no extra cost. And the third thing is to remember our foreign medical graduates. There are foreign medical graduates living as landed or as Canadian citizens, and they require, like myself, the ability to have their qualifications recognized, to have them incorporated and integrated into the Canadian system.
Thank you, Dr. Wilcox. On to Michael.
So by now you've probably heard the ADP commitment that we would like to have 1,200 doctors trained in 10 years, which that is the verb used in the document, which I have in front of me, as well as having 6,000 nurses trained in the next 6 years, in addition to other healthcare providers and other occupations. So we do think that the training is important. We also think recruiting is important. We've laid out very clearly 3 groups that we would have. We'd have programs in place to recruit and retain from. So that'd be people from low-income backgrounds, First Nations people, and my brain just stopped on the last one, and rural communities, obviously. And if those are somewhere where the shortages are, oftentimes, you might want to go back and live in the community you grew up in, right? So we need to be making sure that people feel welcome and supported going from those communities into med school, and that there's a higher chance that they might actually return and provide there. When I was a student, myself in the 90s, after the Liberal cuts transfer payments, our government was then forced to, the Harris government in Ontario began to deregulate tuition fees. And so you have experienced the deregulation of your tuition fees. And I'm a high school teacher, and I tell you, when my students from low-income backgrounds look at the cost of tuition for different programs, they decide right off the bat which ones they can go into and not go into based on those fees. So I think a lot of people self-select out of medical care and medical professions because of the deregulation of fees. And that's a serious concern. You can't just say to somebody, when you graduate, we'll give you some of the money back and it'll be okay. Because they've already decided before that is not their profession. They'll go into something they can afford to go into. And that's a reality that youth experience and that I see every day, which I think is a core piece. And as a teacher, I am someone who works in the public system. And I know that the things that will keep me there and not make me go to the States or somewhere else is stress. And you have to make sure that the system that's in place has the most reduced stress possible, is the most supportive for professionals. Because we don't want people who we do train to then leave. Because there are systems where they can go and they get more money, but even more than that they have a life and a workload that's reasonable and manageable. So we have to make sure that our doctors are respected and are given dignity in their workplace.
Thank you very much, Michael. So does anyone have a question or response they want to make?
I guess one of the responses that I'd like to make is how we back up into the pipeline in high school. And I'm very proud that the Liberal Party has put in place a learning passport, which would allow children or young people who may not consider post-secondary because maybe their parents didn't go to university, they'd never really considered it, but by opening an account for them, knowing that there would be $4,000 as they finish grade 12, for them to contemplate post-secondary education, I think will really hopefully be able to tip the balance to somebody considering university. And it would be $1,500 a year for people from low-income families, which is what the Canadian Federation of Medical Students really looked at, was how we could get more students from low-income families. And I guess the other piece is, I think that the program put forward by the Indigenous Physicians Association is spectacular. And I think that we really, in order to reverse colonization, have to do everything we can to end up with more Indigenous physicians and nurses.
Thanks so much, Dr. Bennett. Michael, you had a question or comment?
Just another comment was that so the NDP is committed for $800 million to be put towards college and universities to reduce tuition fees. So we are in the belief that rather than giving money to individuals, that it's actually the tuition fee itself that should be reduced across the board. The rising tuition fees are unacceptable, and they've gone way too high. So a freeze isn't actually good enough anymore. That we need to reduce our levels and but not at the expense of facilities. So there's also in tandem with making sure there's capital costs for schools, because they have to get the money somewhere for the new technologies that are emerging. So those things have to happen in tandem.
Right. Other comments or questions?
I would love to hear from the students that I learned. And it's obviously not in the Liberal platform, but something that has always bugged me a tiny bit. That as you go across the country and you see all the doctors from South Africa, all the doctors from emerging democracies and countries, that Norway has decided for any physician that they take, they give back in some sort of quid pro quo into their medical education system in that developing country. And I just was wondering if we could build a small groundswell of support for an idea like that, because there's no question the South African doctors weren't staying there because of violence and because of many other reasons, and if they hadn't come here, they would have come to Australia, New Zealand, England, somewhere else. But I do think that somehow that we ought to be giving something.